Welcome. Learn about Tylenol Paracetamol acetaminophen. Tylenol/Tylenol/ is a brand of drugs advertised for reducing pain, reducing fever, and relieving the symptoms of allergies, cold, cough, headache, and influenza. The active ingredient of its original flagship product is paracetamol, an analgesic and antipyretic. Like the words paracetamol and acetaminophen, the brand name Tylenol is derived from a chemical name for the compound, an acetyl-para-aminophenol. The brand name is owned by McNeil Consumer Healthcare, a subsidiary of Johnson & Johnson. As of 2020, the Tylenol brand was used in Brazil, Canada, China, Egypt, Kuwait, Lebanon, Lithuania, Mexico, Myanmar, Netherlands, Oman, Paraguay, the Philippines, South Africa, Switzerland, Taiwan, Thailand, the United States, Uruguay, Venezuela, and Vietnam. The active ingredient in Tylenol is paracetamol, a widely used over-the-counter analgesic and antipyretic. Formulations with additional active ingredients intended to target specific applications are sold under the Tylenol brand. These can include codeine is cocodamol, dextromethorphan, methocarbamol, guaifenesin, pseudoephedrine, caffeine, diphenhydramine, chlorpheniramine, and phenylephrine. Paracetamol, also known as acetaminophen and APAP, is a medication used to treat pain and fever. It is typically used for mild to moderate pain relief. There is mixed evidence for its use to relieve fever in children. It is often sold in combination with other medications, such as in many cold medications. Paracetamol is also used for severe pain, such as cancer pain and pain after surgery, in combination with opioid pain medication. It is typically used either by mouth or rectally, but is also available by injection into a vein. Effects last between 2 and 4 hours. Paracetamol is generally safe at recommended doses. The recommended maximum daily dose for an adult is 3 to 4 grams. Higher doses may lead to toxicity, including liver failure. Serious skin rashes may rarely occur. It appears to be safe during pregnancy and when breastfeeding. In those with liver disease, it may still be used, but in lower doses. It is classified as a mild analgesic. It does not have significant anti-inflammatory activity. How it works is not entirely clear. Paracetamol was first made in 1877. It is the most commonly used medication for pain and fever in both the United States and Europe. It is on the World Health Organization's list of essential medicines, the safest and most effective medicines needed in a health system. Paracetamol is available as a generic medication with trade names, including Tylenol and Panadol, among others. The wholesale price in the developing world is less than $0.01 per dose. In the United States, it costs about $0.04 per dose. In 2020, it was the 25th most prescribed medication in the United States, with more than 24 million prescriptions. Fever. Paracetamol is used for reducing fever in people of all ages. The World Health Organization recommends that paracetamol be used to treat fever in children only if their temperature is higher than 38.5 degrees Celsius. The efficacy of paracetamol by itself in children with fevers has been questioned, and a meta-analysis showed that it is less effective than ibuprofen. Paracetamol does not have significant anti-inflammatory effects. Chemical properties. Paracetamol consists of a benzene ring core, substituted by one hydroxyl group and the nitrogen atom of an amide group in the para pattern. The amide group is acetamide. It is an extensively conjugated system, as one lone pair on the hydroxyl oxygen, the benzene pi cloud, the nitrogen lone pair, the p orbital on the carbonyl carbon, and one lone pair on the carbonyl oxygen are all conjugated. The presence of two activating groups also make the benzene ring highly reactive toward electrophilic aromatic substitution. As the substituents are ortho, para-directing, and para with respect to each other, all positions on the ring are more or less equally activated. The conjugation also greatly reduces the basicity of the oxygens and the nitrogen, while making the hydroxyl acidic through delocalization of charge developed on the phenoxide anion. Paracetamol is part of the class of drugs known as aniline analgesics. It is the only such drug still in use today. It is not considered an NSAID because it does not exhibit significant anti-inflammatory activity. This is despite the evidence that paracetamol and NSAIDs have some similar pharmacological activity. Available without a prescription since 1959, it has since become a common household drug. Patents on paracetamol have long expired, and generic versions of the drug are widely available. Paracetamol is available in a tablet, capsule, liquid suspension, suppository, intravenous, intramuscular, and effervescent forms. Intravenous acetaminophen is sold under the brand name Ofirmov in the United States. Naming: acetaminophen is the name generally used in the United States, Japan, Canada, Venezuela, Colombia, and Iran. Paracetamol is used in international venues. In some contexts, such as on prescription bottles of painkillers that incorporate this medicine, it is simply abbreviated as APAP. For acetyl-para-aminophenol, both acetaminophen and paracetamol come from a chemical name for the compound, para-acetyl-aminophenol and para-acetyl-aminophenol. Cost: the wholesale price in the developing world is less than $0.01 per dose. In the United States, it costs about $0.04 per dose. Thank you for watching this video. Goodbye.